case control study or retrospective study. It is known as retrospective because it moves from the disease to the exposure. So already the disease has happened and we are trying to know what is the related exposure or the cause. So let us see the study design. Broadly, it is divided into two groups, that is the disease group, that is also known as case, and the non-disease group or the control group where there has no occurrence of disease. Further, the disease group is subclassified into exposed and non-exposed group. So for example, if the disease is a tooth loss, the exposed group will be periodontitis and the non-exposed group will be non-periodontitis patients. And we see that if periodontitis is associated with tooth loss, in the non-disease group, the exposure will be periodontitis, whereas non-exposed group will be the one which are not exposed or having periodontitis, and so there is no occurrence of disease. Now, if we see broadly the example, for example, it will be if to assess if periodontitis is associated with tooth loss. So, tooth loss would have been already happened, and we will take the case history of the patient and ask if they have ever suffered with periodontitis. In the similar way, let us take another example. Playing PUBG is associated with late night sleeping. So, the people will be already sleeping late night, and we will ask them that if they were playing PUBG, and if the number of how many of them say that yes, we were playing, depending on that we can say that playing PUBG is associated with late night sleeping. So the exposure or the PUBG is already happening, and we are asking or going back to the past and just digging the answer. What is the advantage? It is inexpensive, it is short term, it is good for rare diseases, and it requires a very small sample size.